Okay, so again, causes, same type of deal, both genetics and brain differences. So ADHD tends to have a 70% concordance rate in identical twins. So there is definitely a genetic component to this. And then again, structural or functional differences in the brain. I want you to pause real quick and think about, where do you think in the brain might have some differences in ADHD? So considering the types of deficits that occur, where in the brain do we think make those kind of actions and choices? So if you remember back to the neuro lecture, your frontal lobes, your prefrontal cortex in particular, are known for those kind of decision making and judgment and not acting on impulses, that kind of thing. So these individuals tend to have pretty underactive frontal lobes, and the frontal lobe matures a lot slower in these individuals. So yeah, when those kind of inhibitory processes in the frontal lobe that inhibit, the kind of risky behaviors aren't working very well, hyperactivity and impulsivity might result. But there's also environmental factors as well. So lead contamination, you might have heard before, has been linked in some capacity to development of ADHD. Um, Also just like low birth rate, prenatal exposure to different kind of drugs or alcohol. So some environmental factors that could also contribute. Okay, so treatments wise, starting biological again. So there is stimulant medication. So you might have heard of things like Ritalin or Adderall, for instance, but it might seem kind of weird to treat ADHD with a stimulant, right? If you're hyperactive already, wouldn't a stimulant make it worse? So the reason stimulants get used here is because this kind of impulsiveness, this hyperactivity, occurs because your frontal lobe is not as active as it should be to inhibit those behaviors. So if your frontal lobe is kind of less developed and less doing its job, you have to stimulate your frontal lobe to crack down and be more better judgment making and less impulsive. So that's why stimulants often get used. But there's also psychological as well. And these tend to be kind of more social focused. So some training, behavioral training, so a therapeutic approach with parents. So maybe using some sort of operant conditioning kind of step in order to reward or help that child better inhibit those responses. But also peer focused treatment. So getting that child to kind of better assimilate into their classrooms, for instance, better focus in a school setting and kind of just focus on how they interact with others.